Good morning, Mr. Jim. My name is Joe. It looks like you're having a liver panel done. I just wanted to go over some of the tests you'll be having done. The first one you're going to have is AST. The purpose is to find damage in the liver, heart, muscles, and kidneys. If you have increased levels, you might experience nausea, fatigue, and abdominal pain. If they're decreased, you might have muscle weakness or poor metabolism. Before the test, they're going to do 3 blood draws 3 days in a row, and then during the test, they're going to do 1, collect the sample. After the test, you're going to apply some pressure to the site and resume normal living. The next test you're going to have is ALT. The purpose is to check for liver damage. If you have increased levels, you might experience dark urine, jaundice, or loss of appetite. If they're decreased, you might experience muscle weakness, fatigue, or a nutrition deficiency. Before the test, there's no restrictions for food or fluid. During the test, they're just going to draw your blood, and then you're just going to apply some pressure until the bleeding stops. After, you're just going to continue the pressure to prevent a hematoma. Next test you're going to have is ALP. This purpose is to find liver and bone disorders. If you have increased levels for that, you might have jaundice, bone pain, or severe itching. If they're decreased, you might get a numbing or tingling feeling. You're going to fast for 8 hours before the test. During the test, they're going to draw your blood, collect a sample, and after, you're just going to apply pressure until the bleeding stops and you can resume a normal diet. The next one you're going to have is direct bilirubin. The purpose is to check for bile and duct blockage. If you have increased levels, you might experience jaundice, dark urine, or light-colored stool. Decreased levels, they're not really many, it's pretty rare. Before the test, they're just going to draw your blood. During the test, they're going to collect another sample. And after the test, you're just going to apply some pressure to the site until it stops bleeding. The next test you're going to have is total bilirubin, and this one assesses the function of your liver. If you have increased levels, you might experience jaundice, fatigue, or severe itching. Again, there's not much for decreased levels, those are pretty rare. Before the test, you're going to have to fast for 4 hours prior to the test. During, they're just going to draw your blood and collect a sample. And then once they're done, you just apply pressure to the site until the bleeding stops. The next test you're going to get is albumin. This checks nutrition and liver status. Increased levels might experience dry mouth, dehydration, or extreme thirst. If you have some decreased levels, you're going to experience fatigue, edema, and poor healing. There's no fluid or food restriction before. However, certain medications will have to stop prior to the test. During the test, they're going to draw about 5 to 10 milliliters of blood. And then you're just going to apply pressure until bleeding stops. After the test, you're going to want to make sure you eat a high-protein diet. And the final test that they're going to do is total protein. This checks for chronic illness and nutrition level. If the levels are increased, you're going to experience dehydration, joint stiffness, and fatigue. If you have decreased levels, you're going to experience edema, muscle loss, and thinning of hair or nails. Before the test, they're just going to draw your blood. There's no fluid or food restrictions. During the test, they're going to do another blood draw from your arm. You're just going to apply pressure until the bleeding stops. And after the test, you can resume your normal life, normal medications. And that's it. If you have any questions or need me to go back over anything, please feel free to ask.